Hi, I'm Annie Fitzsimmons, the legal hotline lawyer for the Washington Association of Realtors. This video is a joint production effort of the Washington Realtors and Northwest MLS, intended to be an office training tool to ensure your office is in full compliance with Phase 2 of the Governor's Stay Home, Stay Healthy order. As you begin to think about reopening your office, it's important to train your brokers and staff as to the protocols intended to keep them healthy while in the office. If you're in a Phase 2 county, the training is mandatory, and perhaps it will be when your county emerges into Phase 3. We don't know yet what the protocols for Phase 3 will be, and when this whole pandemic subsides, it will still be a good idea to carry forward some of the disease control measures we've all learned to implement over the last few months. If you're a designated broker in an office that is reopening during Phase 2, you must train all of your staff and brokers who will be in the office with all of the information in this PowerPoint. The information in the presentation comes directly from the governor's required Phase 2 protocols, and the training is required. When Phase 3 arrives and protocols are announced, we'll let you know whether the training is still required or if it's been modified. And when we have a vaccine, Washington Realtors may modify the training to eliminate some of the slides associated with the coronavirus lockdown specifically. That will leave you with a tool that's helpful just in remembering the practices we've all developed over the last few months. But until then, every item in the presentation is part of the training that's required for Phase 2 office openings. Designated brokers, you must teach the PowerPoint presentation in its entirety. It is intended to, if you intend to open your offices during Phase 2. Additionally, as you watch the presentation, you'll see that there are slides regarding activities such as frequent cleaning of high-touch surfaces and sanitizing that's required for the bathroom areas in your building. DBs, you must actually appoint people within your staff to be responsible for doing all of those things required in these protocols. I'm sorry, I shouldn't say within your staff. I don't care where you find the people to do these things, but it's important, it's required that you appoint somebody to make sure that all of these tasks that are identified in the slides are actually handled day to day. And ultimately, it's your job to oversee and make sure those things happen. Here to walk you through the plan is the fabulous Jim Sissel.
This COVID-19 exposure control, mitigation, and recovery plan includes policies, best practices, and helpful suggestions to comply with the governor's Phase 2 requirements to reopen your real estate office. The plan is available online to download and print. A copy of the plan must be posted at your place of business and readily available to all employees and independent contractors. Mandatory signage will be posted in the office and common areas. Unless otherwise noted, all these guidelines apply to all employees and independent contractors. Let's begin with personal protective equipment, or PPE for short. You must wear cloth face covering at all times when not working alone. Wear cloth face coverings and disposable gloves where safe and applicable when appropriate for such activities as handling documents or other items that will be shared with others. Gloves are to be discarded after a single use. On-location physical distancing. Maintain minimum 6-foot separation between all persons in all interactions at all times. Use physical barriers and markings on the floor if necessary. When physical distancing is not feasible for a specific task, use barriers and PPE to limit physical interactions. Require all clients to make appointments for in-person meetings or services. Post a notice for walk-up guests regarding access to the facility, including the phone number guests should call to determine availability of services. The notice should strongly encourage guests to use cloth face coverings when inside the office and notify guests that they'll need to answer questions regarding COVID-19 exposure and their current health. Access to the office should primarily be through the front door, Access where unauthorized visitors may enter, such as back doors and entry points, will be restricted. The number of persons in any waiting area will be minimized. Furniture will be arranged to enable social distancing with at least 6 feet between individual seats. Small conference rooms that do not allow for social distancing will be closed, and high-traffic common areas will be managed so that social distancing is always maintained. Occupancy of the office will be capped at 50% of maximum capacity or lower. Counties in modified Phase 1 will be capped at 25% of capacity, and indoor appointments will be limited to 30 minutes. To limit crowd size, take breaks, perform activities, and eat lunch in shifts. Anytime 2 or more persons meet, that minimum 6-foot separation will be maintained. For any necessary travel, no vehicle shall carry more than 1 person unless they're part of the same household. Hygiene and sanitation. You must frequently and thoroughly wash hands for at least 20 seconds, including before and after all client interactions, going to the bathroom, and eating, and after coughing, sneezing, or blowing your nose. Water and soap will be readily available. Hand sanitizer with at least 60% alcohol will be available and distributed throughout the office. Cleaning supplies will be frequently replenished. A housekeeping schedule will include frequent cleaning and sanitizing with a particular emphasis on commonly touched surfaces. Tissues and trash cans will be made available throughout the worksite. HVAC system filters will be changed frequently. The restrooms will be frequently cleaned and disinfected throughout the day. Face shields or sneeze guards will be placed throughout the worksite at all places of potential human interaction. High-touch surfaces, such as shared items, machines, or other equipment, handrails, doorknobs, and restrooms, will be frequently cleaned by workers with appropriate PPE. Areas which cannot be cleaned and disinfected frequently will be shut down until required measures can be achieved and maintained. COVID-19 safety training. All on-site employees and contractors will be trained on the business's policies, this plan's requirements, and relevant sanitation, disinfection, and social distancing protocols. And they will be educated about COVID-19 and how to prevent transmission. Training will be accomplished through weekly office meetings, where attendance is logged by the office manager or designated broker. System monitoring. Everyone must take their temperature at home prior to arriving at the office, or their temperature will be taken when they arrive at the office with a no-touch or no-contact thermometer. Those with a temperature of 100.4 degrees Fahrenheit or higher, or who appear or feel sick, or who have been in close contact with a confirmed COVID-19 positive case, must stay home or be sent home. They will be asked if they have any COVID symptoms, a fever, cough, shortness of breath, fatigue, muscle aches, or recent loss of taste or smell. If they develop acute respiratory illness, they must seek medical attention and inform the manager or broker. Each office will designate a site-specific COVID-19 supervisor to monitor the health of employees and contractors and apply this plan. Incident reporting. Everyone must report to the office manager or designated broker if they have any symptoms of COVID-19, or they have a sick household member at home diagnosed with COVID. They must follow the State Department of Health's isolation quarantine requirements. If you develop symptoms while at the office, you will immediately report it and be sent home. If symptoms develop while not working, you must not return to work until you've been evaluated by a health care provider. Exposure response and location disinfection procedures, and post-exposure incident recovery plan. Areas where those with probable or confirmed COVID-19 have worked, touched surfaces, etc., will be cordoned off until the area and equipment is cleaned and disinfected. The CDC's deep cleaning and disinfection guidelines will be followed. If a COVID-19 infection occurs, the office manager or designated broker will inform all other persons determined to have been in close contact and tell them how to proceed based on the CDC public health recommendations for community-related exposure. But confidentiality will be maintained as required by the Americans with Disabilities Act, ADA. Out-of-office activities. In-person residential and commercial real estate activities under RCW 1885-1117 and related activities performed by real estate brokers and industry partners for both improved and unimproved real property can only be conducted by following these limitations. The activities must meet social distancing and appropriate health and worker protection measures. For in-person activities, brokers and industry partners must wear cloth face coverings and should encourage clients and customers to do the same. In-person meetings with customers are prohibited except when necessary for a customer or broker to view a property or sign necessary documents. No open houses are permitted. Viewing property shall be done by appointment only. Appointments are also required for inspection, appraisals, and final walkthroughs, and are limited to 3 people on site, exercising social distancing at all times. Other than these limited exceptions, all real estate listings should be facilitated remotely. Well, that's it. I know it's a lot, but these precautions and safety measures can save lives, and they are required to open your office during this pandemic.